Hi, I'm Dr. Dana Churchill. I'd like to tell you a little bit about my background and about my clinic here in West LA. When I first started on my journey, I actually was in chef school. I had no idea that I'd ever be a doctor back then. So I went to chef school in New York City for a couple of years, got my degree in culinary arts. So we learned haute cuisine at the time, the heavy French cooking. It was all French food, sauces, the works, you know, the whole 9 yards. And after that, it started getting lighter and lighter. I branched out. I guess in like the last 5 years, I started getting into a lot more Asian cooking. And I still cook for friends and for parties at my house. And I've actually integrated a lot of it into my practice for my patients. After that, I went to Rutgers, New Jersey, for clinical nutrition, clinical biochemistry, because I was actually searching what was wrong with me. It's kind of like after all those years in the restaurant business, I was really burned out. I was having panic attacks. I had high blood pressure, very high blood pressure, three medications. They were just about to put me on a statin, which I probably wouldn't have taken anyway, but they were going to try to put me on a statin. My cholesterol was high, my triglycerides were high, and I was skinny. It was very interesting. And I was pre-diabetic at the time. And I was eating pretty healthy. I was taking handfuls of vitamins, minerals, herbs, and I still wasn't healthy. So I said, you know, what's really going on here? I got to figure this out, because I didn't know if I was going to be able to work. You know, sometimes it was really rough. So I said, all right, I'm going to study nutrition at Rutgers. I'm going to find out what's wrong with me, and then I'm going to possibly go to medical school and figure out everything by then. And it actually worked out that way. So little by little, I started realizing for me that the hypertension, the panic attacks, the eating food and falling asleep on the side of the road, falling asleep at the wheel, these are all food sensitivities. Very, very powerful food sensitivities, and many of them are from wheat. Wheat was just my enemy, basically. Wheat, dairy, there's a bunch of other ones too, and I had to get rid of all the sugar. If I just had a little bit of sugar, I'd fall asleep. My body couldn't handle any more of these toxins. These are toxic to me. And that had happened because of all the years of the French food. I was going into the finest restaurants. I worked in France and Switzerland. So and a lot of alcohol, you know, smoked cigars, it took a toll on my body. So at that point, I had to say, you know, what's happening here? So we started doing a lot of testing. I started doing ELISA pinprick test. I started doing IgG, food sensitivity panels, stool cultures, everything in the world, and I started learning what I'm teaching my patients now on myself. So that was a really amazing time in my life. Discovery, a journey of discovery and reflection. Not easy at all, but to find out what's really going on with me. Why can't I function the way I want to function? And then after that, I went to the National College of Naturopathic Medicine. Well, I graduated in 2005, and then we opened this clinic here in West LA. Not this exact one, but I started working in California. I moved from Oregon down here. And I started integrating and implementing all the different types of, you know, over those years I worked at the Princeton Biocenter back then for 4 years with MD, PhDs, and DOs, and a lot of docs doing cutting edge medicine. I learned so much from those docs, and I started implementing everything that they taught me right here for my patients. So it's been an amazing journey. I'd like to talk about a couple other subjects today, though. One is thyroid. Basically, thyroid it's called the canary in the coal mine because it's one of the first glands to go in the human body, especially in the toxic environment we're in today. You can't see the toxins, but they're literally all around you. And if you're not constantly flushing them out, cleaning them out, fasting, detoxing, meditation, some kind of form of this, I mean, this needs to be part of your daily routine these days because there's so many toxins, they just build up, and they build up and build up, and you start getting symptoms. Well, those symptoms are not the enemy. Those symptoms are what we need to use to find out what's going on with you. And with cutting-edge labs and different types of, you know, physical exams, we can really narrow it down on a very holistic level, what's truly happening to you by using the body's symptoms and using the body to understand. But right now there's a huge epidemic of what we call subclinical hypothyroidism. That's low thyroid, that your thyroid isn't working very well. Don't be confused with hyperthyroidism, which is like Graves' disease, where your thyroid's working so well, it's cranking out so much that your heart's beating fast, and you know, that's very dangerous actually. But the subclinical hypothyroidism is very, very underdiagnosed. One of the biggest reasons is the labs many doctors only do TSH, thyroid stimulating hormone. And if that's all you do, you're not looking at the full parameter of the thyroid, you're not going to get good information. And there's another problem with this thyroid stimulating hormone is that the high end of the parameter, the marker, it goes up to 4 or 5. But what we really need to do is lower it down to 2. If your TSH is ever above 2, basically you're going to start having symptoms. And we've also seen patients have symptoms even before the TSH gets to 2. The other parameters you have to measure when you're measuring your thyroid, make sure you tell your doctor this, is the free T3, that's one of the thyroid hormones, that's the one that does the work, and the free T4, that's the storage that gets converted to T3. You should also be doing a reverse T3 to check the adrenal glands, because some of the same symptoms of the thyroid dysfunction will be mimicked by the adrenals. You should also probably check your antibodies, the TPO antibodies, the TG antibodies, and also the proteins that carry the thyroid. So we have labs now in my office. It's only $50 for that because we've researched it where we get the cheapest one. So basically, what you want to remember about thyroid is also there's an epidemic of iodine deficiency in America these days. So, you know, the Morton salt that people kind of put on in the shelf, and instead they're using designer salts, or using sea salt. Well, that's wonderful. Sea salt's really good for you, but basically you gotta bring back the Morton salt girl, the little girl with the umbrella. Remember her? I'm old. I'm sorry. I'm dating myself, but that little girl is really important because they would put that iodine in that salt many years ago. This is one of the good things that our government did because there was an epidemic of iodine deficiency back then. So make sure you use some of that salt and some sea salt at the same time. And also many women have stopped cooking with salt for their husbands because their husbands got hypertension, high blood pressure. So what we need to do is get some form of iodine in the body, and a lot of people's thyroids will start working much better with just some iodine. It's a very cheap treatment. But many people now, along with the subclinical hypothyroidism, have started to get full-blown what we call Hashimoto's thyroiditis. Hashimoto's is when your body's being attacked by antibodies. And a lot of that I've found in my practice is from heavy metals, from leaky gut syndrome, from food sensitivities, and from major stress. So when we start working on all those 4 issues, we start to turn the Hashimoto's around. Also, we also use a treatment called T3 therapy, which works quite well to kind of quell the antibodies and kind of reset the thyroid. But that's not an easy therapy to do, so make sure you go to a doctor that really knows what he's doing with that. Thank you.